Today we're talking about lateral ankle sprain or going in. So I'd like you to see if with an inversion ankle sprain, often you injure this outside of the ankle. Sometimes you can also hurt through here too. So we'll talk about the assessment of the ankle. So just one of the things we'll look at will be balance and also single leg calf raise. Alright, so firstly when we assess an ankle of an inversion sprain, there's a few things that we look at. Commonly there's injury of either CFL, calcaneal fib ligament, ATFL is the common ones get injured. Also we have a palpate of the fifth metatarsal. Sometimes you get a small or avulsion fracture through there. You can also get fractures of your distal fibula, so we'll palpate through distal fibula. And then the talar dome, we can just feel through the talar dome, see if there's any bone bruising, etc. as well. So as well as that, we can check for range of motion. So I can check for the range of motion of the ankle and see if there's any limitation. Now, with an ankle sprain, after an ankle sprain, it's quite often that it's tender going in as it's stretching through these ligaments through here that often have a tear or a strain. Sometimes it can be stiff going back and also out to the side, which is the opposite direction that it's sprained. We can also have a look at the ligament strength of the ankle. So we can do anterior draw test, so I'm stabilizing through here and just drawing forward. And I'm just checking for how strong that ligament through there is. We can also then do a talar tilt, so I'm going to hold onto there and just gripping the ankle and just checking how stable the ankle is going in. That's looking at the CFL ligament, which sits just in through there. As well as that, after doing the palpation, those assessments, we can check through some muscles around the ankle. So quite often there's tightness and tension, and you can get partial tearing of the perineal muscles through there. As you go in, it gives a quick stretch and strain to those muscles, so we check those in trigger points through there. In addition to that, what we can also do is look at through the ankle mobilization of the joint. So again, we look at see if the ankle is sitting back okay. I can check if this joint is working correctly. Sometimes you get some stiffness of this joint here, the distal tib fib joint, and some mobilization can help the ankle through there. We look at range of motion, so look to see again if there's range of motion limitations, up and down, in or out. And then we check to see which joints can be affected, whether talar crural joint, subtalar joint, distal tib fibula joint are common ones that can get affected. Then we also have a look at strength of the ankle. So strength, so pushing in that way, okay, and pushing out, and pushing up, and pushing down, okay. Now very commonly after an ankle sprain, we have weakness of the perineal muscles through here, and sometimes we have weakness through there as well, and so strength in those muscles can be really important.